So good afternoon, everyone. So how many of you have thought of having a clone? One clone? Two clones? Three? Well, I can say I have at least 30, 40 at the moment. Yes, 30, 40 clones. And I'm not talking about the science fiction, a Shah Rukh Khan movie or a Bollywood or a Hollywood movie where you see a duplicate of yourself. I'm talking about the clone of your skills, your surgical excellence, a clone of your knowledge. And we really don't want to have many such clones. I clearly remember in 1995, that was my first day as an orthopedic junior doctor, and my senior walks in the room and tells me that he got trained in the era where a fracture was reduced with the towel over the wrist so that no one could see and learn what was the maneuver to reduce it. What a waste of skill hidden under the towel. I think it's a tradition. And we think this tradition doesn't exist now. It does. But the ways have changed. Now we are told, you are too young to learn this. You need to be more senior. You can observe it from that corner. My dear friends, I am Dr. Hemant. I work as an orthopedic surgeon. I'm a mentor. I'm one of the fitness runners. And I have nearly 30 years of experience, both India and UK, trying to club the robotic technology with the forgotten art of human empathy. And today, I'm going to be talking about courage, the courage to teach. Do you have the courage to let your junior be better than you or a better version of himself? Well, I'll share some incidents with you that happened. First of all, do you know there are certain diseases which are not mentioned in the books? We doctors have it. I'm sure not only doctors but many entrepreneurs, students, many people would have it. And there's no investigation for this disease. It is not mentioned in the books. Yes, it is a disease of insecurity. When we have a complication, we discuss it in the mortality and the morbidity meetings. And we don't even discuss there. We don't even come out with the fears because we feel that if someone is better than us, especially in the corporate world, we will be replaced. And we don't want to be replaceable. We want to be indispensable to the organization, to the world. And I feel a surgical excellence should not die with me, or in fact should not die with anyone. We need to carry it forward. I, by default, got the treatment of my disease when I went to UK for a higher surgical training. The system was entirely different from what it is here. The mentors want you to be successors. They don't think you're rivals. They are standing beside you and not above you. And you'll be surprised that if a trainer fails to train, the trainee is taken away. And the assessment system is so structured that you have to rise step by step. And I still remember my mentor telling me, you have to be the best because that's the only proof that I taught you. And I think this thing stuck in my mind. And I thought, if I get to go back to my country, I would carry this vision forward if I could. I remember an incident in the operating room, one of my junior fellows performing a surgery, a step where my heart would beat faster. And it took me, trust me, it took me 2 decades to learn that. And he did it seamlessly well, precisely without committing any mistake. And he looked at me and something came in my mind. It was a mixture of a pride because I taught him, but at the same time, there was a fear in my mind. I am probably now replaceable. But before the fear could overtake, the pride stood. And I remember the words, you've got to be the best because that's the only proof I am your teacher. I taught you. Well, that was my mission, that was my vision. And that's the vision I came back to India thinking to create a center of excellence where I could not only deliver something best for the patients, but at the same time have a legacy of people around you who can perform as good as you, or they are the best version of yourself. Just a couple of days ago, we were in a marriage, and my mentor was there, and there were 40 students. And all of them, some of them are running big corporate hospitals worth 2,000 crores. Some of them are heading the medical colleges. And he said, I can die in peace now seeing all of you doing so well. I think that's the vision we should have. Knowledge should be shared. It multiplies by sharing. It's not something you need to keep it to yourself. I don't want a skill which took me 3 decades to learn. My junior should also spend at least a decade to learn that. This is an era, do one, see one, and teach one. We're in a very fast forward world. Now, surprisingly, patients are just the same. Doesn't matter you are practicing in England or you're practicing here. Every patient wants me to be perfect all the time, every time, in every case. And they just ask me, what is the success rate of the surgery? Everyone wants their surgery to be first because they feel I'll be too tired before I do the 5th one or the 6th one or the 7th one. I'm a human being too. I do commit mistakes, and I believe complications and mistakes are different. And complication is a part and parcel of surgery. Yes, mistakes, there is no room, but complications, avoidable. That's the vision when I thought we should have a technology which should add precision and accuracy and subjectivity to my patient. And I'm glad to share that we were the first center to have the robotic technology in the Delhi NCR. And I feel a lot of people don't know what a robot is. They think I'm probably having a cup of coffee sitting in my room and there's some machine going and performing a knee or a hip replacement surgery. That's absolutely wrong. It's merely an extension of my arm. It does what I tell it. I do the data feeding in it, and it just cuts so precisely that there is no role of error in it. And I have been criticized, critiqued, because people think it's a marketing gimmick, but I feel no. I add objectivity to the subjective surgery. When patient says, how was the surgery? I can confidently tell him, it went very well. I've got good numbers and data to show that your legs are equal after the hip replacement surgery. It has helped me. I don't get tired. I'm as fresh as I am in the first case or in the 7th case. Once the data is fed, I can give it to my junior doctor. He can do the job. It gives him the opportunity to train. I can train him outside the operating room in a safer environment without harming a fellow human being. Because you all know in a medicine, you got to do the things on the patients before you achieve that precision, the accuracy, the confidence. I get more spare time. I don't have achy hands and fingers. My muscles don't ache. Otherwise, imagine working with a drill 7 or 8 times in a day, what occupational hazards I have. Tingling in the fingers, numbness in the fingers, tiredness, chronic fatigue syndromes, and XYZ, many diseases. And now I have more time to spend with my patients. I can talk to them more. I'm more empathetic towards them. I listen to them more. I teach my trainees. I have made their learning curve less steeper. People used to tell me that you should know first how to do a conventional surgery and then learn how to do robotic surgery. I think I agree to disagree with those people because I feel if I teach you something with the technology, it's much easier for you to go back and do it a conventional way because your knowledge is much better. Finally, all I want to say is India is a country, trust me, I've seen lots of countries where doctors are more skilled. The complexity of cases we do does not happen anywhere in the world. When we present a case in the international conferences all of them, they always say, well, we don't get so complex cases. The number of patients are so much that the amount of experience a doctor gets here in 2 years is equivalent to, if not 20, at least 10 years of experience abroad. Technology is here. We have to adopt it. We must admit that we lack courage. We should have courage to accept our mistakes. We should have courage to accept newer technologies. We should have courage to teach the younger generations more generously, so that if not better than me, at least they can be best part of what they are. If we combine the robotic precision with the human art of empathy and club the surgical excellence with courage to teach, I think I'm not going to just heal the bones, I'll heal the entire system in the field of medicine. Thank you.